Front of thigh. In this video, we will cover surface landmarks from iliac crest to patella, superficial fascia, veins, nerves, and lymph nodes, great saphenous vein, course, tributaries, and valves, superficial inguinal lymph nodes, arrangement and groups, subcutaneous bursae, prepatellar and infrapatellar, deep fascia of thigh, fascia lata, iliotibial tract, and septa, muscles of the front of thigh, origin, insertion, nerve supply, and actions. Let's begin our journey through the anatomy of the front of the thigh. Front of thigh extends between the hip and knee joints. The superficial fascia contains one big vein, the great saphenous vein. Besides the cutaneous nerves, vessels, lymphatics, and lymph nodes. Surface landmarks. Iliac crest is a thick, curved bony margin, forming laterally the lower margin of the waist. Anterior superior iliac spine is the anterior end of the iliac crest. Tubercle of the iliac crest is a low bony prominence situated on the outer lip of the iliac crest. Fold of groin is a shallow curved groove which separates the front of the thigh from the anterior abdominal wall. Pubic tubercle is a small bony projection felt at the medial end of the fold of groin. Pubic symphysis is formed in the median plane between the right and left pubic bones. Pubic crest is a short bony ridge between the pubic tubercle and pubic symphysis. The greater trochanter of femur, forming a wide prominence just in front of the hollow on the side of the hip. Mid-inguinal point lies midway between the anterior superior iliac spine and the pubic symphysis. Patella, also known as kneecap, is the largest sesamoid bone of the body. It is easily seen and felt in front of the knee. Tibial tuberosity is a blunt prominence in front of the upper end of tibia, marking the upper end of the shin. The medial and lateral condyles of the femur and of the tibia form large bony masses at the sides of the knee. The most prominent points on the side of the femoral condyles are called the medial and lateral epicondyles. Superficial fascia. The superficial fascia contains cutaneous nerves, the great saphenous vein and its tributaries, and the superficial inguinal lymph nodes. Cutaneous nerves. The skin of the front of the thigh is supplied by 7 cutaneous nerves, derived directly or indirectly from the lumbar plexus. The ilioinguinal nerve emerges at the superficial inguinal ring and supplies the skin at the root of the penis. The anterior 1/3 of the scrotum and the supromedial part of the thigh, the femoral branch of the genitofemoral nerve, L1, L2, pierces the femoral sheath, and the overlying deep fascia, 2 centimeters below the mid-inguinal point, great or long saphenous vein. This is the largest and longest superficial vein of the lower limb. It begins on the dorsum of the foot from the medial end of the dorsal venous arch and runs upwards in front of the medial malleolus along the medial side of the leg and behind the knee. In the thigh, it inclines forwards to reach the saphenous opening, where it pierces the cribriform fascia and opens into the femoral vein. Before piercing the cribriform fascia, it receives 3 named tributaries. Also, many unnamed tributaries. It contains about 10 to 15 valves, which prevent backflow of the venous blood, which tends to occur because of gravity. Incompetence of these valves makes the vein dilated and tortuous, leading to varicose veins. Superficial inguinal lymph nodes. The superficial inguinal lymph nodes are variable in their number and size. Their arrangement is T-shaped, there being a lower vertical group and an upper horizontal group. The upper nodes can be subdivided into the upper lateral and upper medial groups. Subcutaneous bursae. Bursae are lubricating mechanisms which are provided at sites of friction to smoothen movement. Undue or sudden pressure on them may cause their pathological enlargement. Bursae present in relation to the patella are prepatella bursa. It lies in front of the patellae. Chronic enlargement of this bursa is known as housemaid's knee. Subcutaneous infrapatellar bursa. It lies in front of lower part of the tibial tuberosity and of the lower part of the ligamentum patellae. It is sometimes enlarged in clergyman, and the condition is known as clergyman's knee. Deep fascia of thigh or fascia lata. Modifications of fascia lata, iliotibial tract. The fascia lata is thickened laterally, where it forms a 5 centimeter wide band called the iliotibial tract. Superiorly, the tract splits into 2 layers. The superficial lamina is attached to the tubercle of the iliac crest. 2 important muscles are inserted into its upper part, between the superficial and deep laminae. These are the gluteus maximus and the tensor fascia latae. The iliotibial tract stabilizes the knee both in extension and in partial flexion. Saphenous opening. This is an oval opening in the fascia lata. The center of the opening is 4 centimeters below and 4 centimeters lateral to the pubic tubercle, which lies in front of the femoral sheath. Intermuscular septa. 3 intermuscular septa divide the thigh into 3 compartments. The lateral intermuscular septum is the thickest of these septa. It separates the anterior compartment of the thigh from the posterior compartment. The medial intermuscular septum is attached to the medial lip of the linea aspera and separates the anterior compartment of the thigh from the medial compartment. The posterior intermuscular septum is poorly defined. It separates the medial compartment of the thigh from the posterior compartment. Muscles of the front of the thigh. Rectus femoris. It is a long, straight muscle with fusiform bipinnate belly in the upper 2/3 and flat tendon in the lower 1/3. Origin. It arises from the ilium by 2 heads. Straight head arises from the upper part, of the anterior inferior iliac spine. Reflected head arises from a groove above the acetabulum. Insertion. The two heads meet at an acute angle and form a fusiform belly, which occupies the front of the thigh. In the lower 1/3 of the thigh, the muscle ends in a flat tendon, which descends vertically downward to be inserted into the base of the patella. Nerve supply. By posterior division of the femoral nerve. Actions. It extends the knee and flexes the hip. Vastus lateralis. Origin. It takes a linear and aponeurotic origin from the upper part of the intertrochanteric line. Anterior and inferior borders of the greater trochanter. Lateral lip of gluteal tuberosity and upper half of the lateral lip of linea aspera. It also arises from the lateral intermuscular septum. Insertion. It is inserted by a broad aponeurosis into the tendon of rectus femoris, lateral part of the base of patella, upper 1/3 of the lateral border of the patella. Nerve supply. By the posterior division of the femoral nerve. Actions. Extension of the knee joint. Vastus medialis. It covers the medial surface of the shaft of femur. Origin. It takes a linear origin from the lower part of intertrochanteric line, spiral line, medial lip of linea aspera, and upper 2/3 of the medial supracondylar line. Insertion. It is inserted by a broad aponeurosis into the tendon of rectus femoris, medial part of the base, and upper 2/3 of the medial border of the patella. Nerve supply. It is nerve to vastus medialis, which is the thickest muscular branch, by the posterior division of the femoral nerve. Actions. Extension of the knee joint. Vastus intermedius. Origin. It arises from the anterior and lateral aspects of the upper 3/4 of the shaft of femur. Insertion. Into the base of patella, deep to the tendon of rectus femoris. Nerve supply. It is by the posterior division of the femoral nerve. Action. Extension of the knee joint. Articularis sartorius. It is the longest muscle in the body, which crosses the front of the thigh obliquely from the lateral to the medial side. Origin. It arises from the anterior superior iliac spine and upper half of the notch immediately below it. Insertion. The muscle spirals obliquely across the thigh from lateral to medial side to be inserted into the upper part of the medial surface of the shaft of tibia nerve supply. It is by the anterior division of the femoral nerve. Actions. It flexes both the hip and the knee joints and adducts and rotates the thigh laterally to bring the lower limb into the sitting position of a tailor. In Latin, sartor means tailor. Tensor, fasciae latae. It is a short, thick muscle which lies in front of the junction of the gluteal region and the upper part of the front of the thigh. Origin. It arises from the outer lip of the iliac crest, extending from the anterior superior iliac spine to the tubercle of the crest. Insertion. The muscle passes downward and slightly backward and inserted into the iliotibial tract 3 to 5 centimeters below the level of the greater trochanter. Nerve supply. It is by the superior gluteal nerve. Actions. It abducts the hip joint and maintains the extended position of the knee joint through the iliotibial tract. That's the front of the thigh. Thanks for watching.